But in the beginning, in 2014, I was the only one talking about this. I would go to a lymphatic conference and talk to people in the lymphology field, and everybody thought I was nuts. And they said, "That's crazy, what you're suggesting." Now there's been lots of clinical trials. And so now there is actually a lot of people talking about it.
Hello, everyone. Welcome back to Carnivore Today. We truly appreciate you. And today we have a special guest, Leslyn. So, Leslyn, for those that aren't familiar with you, can you kind of tell us a little bit about yourself?
Sure. I'm Leslyn Keith. I'm an occupational therapist, and I got my doctorate in occupational therapy because I wanted to be able to study the impact of nutrition on lymphatic conditions, on lymphedema and lipedema specifically. And I figured the only way I could do a study is if I was be associated with a university and have them back me, and then I can do this research on my patients, basically. And the way I got into doing that was that a lot of my patients were coming to my clinic obese. And with obesity, it puts a lot of pressure on the lymphatic system. And so people were having this battle with their swelling, that their swelling would get worse and worse no matter what treatment we do, what we would do to try to reduce their swelling. It couldn't get better as long as the obesity was present. And so I found out about a ketogenic diet. All the research was showing that that was the best treatment for obesity. And so I wanted to research that, and I was able to do that. Now, I have to put this in the context that I have a private practice in occupational therapy, and I had a lot more freedom on what I can do in that context. If you're working with for someone as an occupational therapist, a lot of times you're limited by what that facility and what your employer wants you to do and will allow you to do. So, because it was my own practice, I pretty much could do whatever I wanted within, I had to stay within my scope of practice for occupational therapy and, obey laws and stuff like that. But since I knew this was going to be wonderful for my patients, I just wanted the support of a university to let me do some research.
Oh, I love that. So, before we start with the questioning, I do want to ask you this. So, did you have experience as an OT prior to doing anything with lipedema or lymphedema?
No, I had decided to get my master's in occupational therapy. It was a way to enter into the field. It kind of didn't matter what your undergraduate was in. If you just take a 2-year master's program, and then you could be an occupational therapist. And so I went that route. And then I said, OTs are really an expert on, or they're have some expertise on many different conditions, but I really wanted to focus on just a particular condition and really give my patients the best that I could for just that condition. And so I got exposed to lymphedema, which is a swelling condition, and how it was treated. And I thought, wow, this is awesome. I want to do that. So I decided to focus on that condition, and was doing that and having a fantastic time for probably about 10 years. But as the time was going, more and more of my patients were actually coming because of the obesity. The obesity was causing their lower legs to swell. And so I felt really very helpless. Um, so I'm trying to help my patients. I didn't know what to do for obesity. And, everybody had been told eat less, move more, and, just go on a really low calorie diet and eat mostly plants and don't eat meat. And that should work. If it doesn't work, it's your fault. And of course, no one gets anywhere with that. And so I was really searching for something that could help people manage their weight in a friendly way, in a sustainable way, in a healthy way. And when I found out I'm in a ketogenic diet, I thought, this is it. I want to work with everybody who's obese and help them with this. I mean, you get really excited when you find something that's going to work.
That's awesome. So, how long had you been doing occupational therapy before you dove into the ketogenic lifestyle?
I would say that I became an OT in 1998. And first started finding about keto in 2011. And my first exposure was Dr. Eric Westman and the studies that he had done. And of course, he had been doing that since the 2000s. And so I thought, wow, I've been wasting a lot of time. I wish I had known about this earlier. So the first thing I did was I adopted this way of eating myself. So I've been doing keto since 2011, and I actually went carnivore in 2019. Um, and um, and now I have a lot of patients that are also doing carnivore, not just doing keto, but actually gone to carnivore because, as you know, there's a lot of health benefits. There's a lot of health benefits just for keto,
Mhm.
and then I always try to get people to do animal source keto. And then if they want to forget about the plants, that's even better. So the more I can bring them over to mostly, if not all, animal sourced, I feel like it's better. And what I learned specifically for the conditions that I work with lymphedema and lipedema, that animal source nutrition is superior for the lymphatic system. It just functions. And so it's not all about just losing the weight. Of course, that helps, but there's more than that. Cutting the carbs and increasing your fat intake really makes the lymphatic system work better.
I love that. So, since you are one of the experts on lymphedema and lipedema, can you explain for everyone what lymphedema actually is?
Sure, yeah, because I had never heard of it until I got exposed to it the first time, you know, I was at an internship actually, and I wanted to specialize in aquatic therapy and do all the rehab in the water. And a person of the OT that I was going to be mentored by, she said, "I just got certified in lymphedema therapy. I don't have time to get in the pool because I have a backlog of patients with lymphedema that want to be cared for." And so, and I would say the prior, about 20 years ago when I started this, it was the main cause of lymphedema was treatment for cancer. That they would remove lymph nodes, then they would radiate your lymph nodes, and then all the fluid um, needed to drain to those lymph nodes that were now damaged or missing. And so that you weren't able to drain, and so then there'd be a backup of fluid and cause swelling. So, for instance, a person that maybe had prostate cancer and had lymph nodes removed, maybe in the groin, maybe in the abdominal cavity, the fluid would back up into their leg, and so they had a very, very swollen leg. And so that was the most common reason. People could be born with an impaired lymphatic system. They would just be missing lymph nodes, missing vessels, and
Mhm.
so the fluid couldn't get out of the body parts the way it should. So it's would stay there, and the swelling would also lead to it would become very hard, very fibrotic and firm. And then it would also be a fertile area for infection. So people with lymphedema quite often get those skin and tissue infections that are called cellulitis, and they
Mhm.
can be life-threatening. And so, to get the lymphatics functioning better, and to get the swelling down is gonna prevent those life-threatening infections. So it's very, very important to address them. And then when I started getting all these people that this swelling was happening in their lower legs because of, the obesity, we had to do something about the obesity, but we also need to do something to feed the lymphatics and help them work better. And that was done through diet.
Awesome. Okay, let's go to the next one, which is lipedema. What is
Yes.
lipedema?
And so I came more exposed to lipedema much later, because lipedema is it is a fat and lymphatic disorder where you have this abnormal, really disproportionate deposition of fat to the lower body. It almost exclusively happens in women, and so that pear shaped obesity is what lipedema looks like, but there's more than just the fat deposit, which can be amazingly excessive. I mean, you can have a normal trunk and then it goes out to very, very wide hips and thighs and down to your ankles, and the feet are not affected. It can also happen in your arms, but then your hands are not affected. But Beyond that, there is a pathology of the tissues because there is excessive and extreme pain that can happen with very light touch, can cause discomfort. And for instance, when you go get your blood pressure checked and you would have that put onto your arm, it can feel uncomfortable to us when they really pump it up high. It is excruciating painful for someone who has lipedema. So
Oh, wow.
they would have frequent and easy and unexplained bruises. So there seems to be some capillary fragility in lipedema. Um, and we get these skin and tissue changes where if the fat deposits extended all the way down to the ankles,
Mhm.
sometimes you would get this what we call a reverse shoulder or a cuff. So you would have the tissue that would come around and just make this shelf right here, and then you'd have a tiny ankle and foot. Um, so there is a specific characteristics that were happening in these women that, and I would say that the most disheartening was that it doesn't matter what you do with low calorie, low fat dieting, you do not lose that lipedema on your lower body and on your arms. It stays. So you would become emaciated in the trunk and face, and nothing would happen to the arms and the lower body. And so but these women were all told, "Well, you're just obese, you better stop eating." I mean, they would go on a extended fast, and become very, very ill, and nothing would happen. And so I was having so much success with my lymphedema patients. I thought, "Wow, I wonder if this would work for lipedema." And I happened to be at the first NIH symposium on lymphatics in 2014. And I met Catherine Sayo there. She's from the Lipedema Simplified and Lipedema Project. And she was looking at my poster of my results of my study that I did with my lymphedema patients. And it was pretty spectacular on everything that they gained. And she said, "Well, if this works for lymphedema, do you think it would work for lipedema?" And I said, I've been wondering that myself. And so she and I started working together. And one thing we did is we went on, we did a, free webinar. We put it out there and we said, "Hey, we think this might work. Talk to your doctor or your nutritionist and give it a try." And you know what? A bunch of women with lipedema independently, no network at all. They just said, "Hey, I'm going to try this." And I was just giving them a handout from uh, Dr. Westman that he gives to his patients was that style of carbohydrate restriction and eating, plenty of fat that you enjoy, and not skipping on protein at all. In the
Mm.
food list, it was, set amounts to do. And I just gave him that. He gave me his permission for me to give it out. So I gave him that. People were doing this on their own and they started contacting Catherine and I and saying, "It's working. It's working.
Wow.
I've lost, all this weight. My pain is down considerably. The size of my legs are down. So it's not just losing weight on my trunk. It's actually something's happening in my legs." It was just pretty astounding. So we thought, well, we got to get organized and, figure out why this is happening. And so that was, Catherine and I met in like 2015. And so we've been working on it since then and it's published several papers on why we think it works. But in the beginning, in 2014, I was the only one talking about this. I would go to a lymphatic conference and talk to people in the lymphology field, and everybody thought I was nuts, and they said, "That's crazy, what you're suggesting." Now there's been lots of clinical trials, and so now there is actually a lot of people talking about it. So I'm so excited that it is becoming more it's not so much accepted, but known. It's not just crazy Leslyn talking about this. There's a lot of other researchers and clinicians that are doing this. Dr. Gabrielle Ferber is in Hamburg, Germany, and she has been using ketogenic diet with her lipedema patients for 15 years with
Mhm.
huge success. It's becoming more accepted, and now, I've gone to many low carb conferences and also talked about this. I will tell you that the low carb community is so accepting of talking about it, talking about lymphatic disorders and the use of this way of eating, just like yourself, asking me to come on here and talk about this. Very accepting, much more accepting than the lymphology community is of this way of eating. Keto is hard enough for them to talk about, but carnivore, well, that's like taking it, it's too far. But I was astounded. I was just at a lymphatic conference in March in Las Vegas, and another speaker was there. She was talking about lipedema, and she said, "Diet for lipedema? Well, we think it probably should be anti-inflammatory diets like a Mediterranean, keto, or carnivore." I couldn't
Wow.
believe it. She said it,
Wow.
and I think it went right by most of the people there listening, but I was with a colleague that he and I both use keto and carnivore. We looked at each other and go, "Did we just hear that?" I mean, so it's getting out there. This is a wave of information and self-experimentation by the person themselves that has the condition. Just like, what you used it for your own health and
Mhm.
well-being. People are doing this themselves and they are letting people know. So it's coming from, the grassroots. This is not coming from the researcher and the clinician. It is coming from the grassroots of people that are using this way of eating and having spectacular changes in their health.
Yeah, I love that she stuck her neck out there and mentioned carnivore because that seems to be a little bit taboo. That's awesome. So you
Yep.
mentioned lipedema fat. So is there
Yes.
a difference between lipedema fat and regular fat? And if so, what is it?
So, and this there we're starting to do more research in that area and actually do tissue biopsies and things to look at that. There seems to be more macrophage activity in lipedema fat. It seems to be in a state of inflammation and hypoxia that is different from obesity. So, this, you can have really excessive fat tissue even in a pear-shaped form that is not painful, that doesn't shelf of tissue at the ankle, that, doesn't have, spontaneous traumaless bruising happen. So there is definitely some differences in the lipedema, and so it's being more studied. We need more, research on it. Um, I recently just published a paper to make and develop a case definition for lipedema because one thing that's been happening is since it's a poorly recognized condition, there's a lot of differences of opinion about what is lipedema. And so you can imagine that when you have all these different researchers doing a study, these researchers have their own opinion of what lipedema is, and so they have 9 women that they study, and they say, "This works for lipedema," and then someone else has a different definition, and then so now we can't do a meta-analysis and put all these studies together. And this is happening on the probably half a dozen clinical trials on keto for lipedema, is that I would love to aggregate all that data, but with different definitions of what the condition is, you can't really aggregate the data and learn more. But every single study with lipedema and using a ketogenic diet has shown has spectacular results that decrease pain, decrease percentage body fat, decrease size in the lower body. I mean, everything is improving on this way of eating. And one study, only one, did blood markers before and after using the diet because, as you know, many clinicians are, well, you could do it for a short time, but the blood is not going to be good after, and so it's not safe after 6 months. I mean, it was a small study. I think it was maybe 45 women. And their blood markers were all fine. I mean, they were checking kidney function and liver function and as well as a lipid panel and all this stuff, and their blood markers were all fine. I was interested that one of the authors of that study, looking at the blood markers, he still says, "I don't know if this is safe for more than 6 months." And I go, "What will it take to prove it to you?"
Right. Wow. Yeah, that's always shocking that, they think that it's sort of a temporary sort of a fix.
Well, every diet that they've heard of, a diet, that's temporary, right?
Mhm.
And so then if we're gonna have women do a ketogenic diet for their lipedema, it's also gotta be temporary. And you know what? A lot of these patients are saying, "Great, thank you. You don't want me to be out for 6 months, more than that? I'm on my own. I'm gonna keep doing it." I mean, once you can't imagine that people are having 8 out of 10 pain constant, and now they have 0 or 1. Do you think they wanna stop that way of eating?
Yeah,
You know,
right.
they were their legs were so large that they were trapped in their homes and they're not mobile. And now they can move, they can get out and at least get to their mailbox. I don't think they're not gonna wanna go back to it how they were eating before. So, like, that's why I say this is grassroots. People are taking control of their own health when they're finding something that works, whether or not their doctor's on board or not.
Absolutely. So, how prevalent do you think lipedema and lymphedema is?
So that is an excellent question and one that is very hard to answer again because we don't have a standardized definition. And um, so I've heard anything from 1% of women worldwide all the way up to 11%. But it
Wow.
depends, and that's for lipedema. And unfortunately, that's the same for lymphedema because lymphedema, it's usually going to only happen in it could happen in both legs, but one leg is always gonna be bigger than the other, whereas or it might happen in both arms, but one arm is bigger than the other, and so, a lot of the definitions for lymphedema is how much of a difference there is between the 2 limbs, and so if you only require, a few hundred milliliter difference, then you're gonna have the incidence be a lot more than someone who requires that there be 1,000 milliliter difference in, volume of that, of the 2 limbs. So, it's they're very difficult to quantify. The feeling is that lymphedema is a pretty rare condition, especially, hereditary or primary lymphedema is pretty rare. Um and now that we are taking out fewer lymph nodes for cancer, that's making it not as common from cancer treatment. In Canada, they did an incidence study to see, why and how many people had it. And interestingly, over 60% of the people in Canada who had lymphedema, I'm not saying 60% have it, but of those who have it in Canada, over 60% have it because of their obesity.
Wow.
So it's and worldwide, obesity is a big issue, and now it's causing lymphedema. So, but lipedema, if it is true that 11% of women worldwide have this condition, you're talking about a pretty common condition. And once you are aware of that body of pretty much it looks like two bodies. It looks like a pretty normal looking trunk and then a very large body on the lower body.
Mhm.
Like you're walking in an airport and you're going, "Oh, that's lipedema. Oh, that's lipedema." I mean, you see it a lot, but of course, it's more than just the shape. It is the other symptoms as well. But I
Mhm.
think it is probably a lot more common than lymphedema is, but not
Mm.
recognized.
That's interesting. So it sounds like there needs to be some work done in terms of how it's diagnosed.
Exactly, exactly. And so we're hoping that our paper on a research case definition, and we describe how you can test for each of those symptoms or characteristics of lipedema. We're hoping that a clinician can also take that same paper and say, well, I can just use this definition here and the ways to assess those things, and I can diagnose lipedema. I mean, there is no blood test or imaging or anything that gives you a diagnosis. It's all done by history, medical history, and the physical examination. And so, I really feel like if the physicians are made aware of our paper, they can use that paper to diagnose their patient.
That's interesting. So that kind of leads me into my next question. So, how familiar are doctors and clinicians with lymphedema and lipedema?
Actually, much more familiar with lymphedema than lipedema. Lipedema has traditionally been seen as this is obesity. And many patients, once they find out about the condition, they go into their doctor and say, "Hey, I think I have lipedema." "Oh no, that's an internet made up disease. There's nothing. That's not a condition." And the problem is that about 80% of women with lipedema also have obesity. And so then you don't see that disproportion so much because now the abdomen, the trunk is larger. And so they don't always recognize the lipedema until they start losing weight and they only lose weight from their trunk. But even in that case, if they were to go into that doctor after they started losing weight and going, "Hey, what's going on? My legs are not getting any smaller. I think I have lipedema." A lot of times, still the doctor does not believe them. So we're trying to increase the awareness about lipedema, and it is improving. One thing that we're doing is presentations for various obesity societies, um, of the Obesity Medicine Association and the Obesity Society, giving presentations there because those are the doctors a lot of times that these patients will go to because I feel like, okay, I'm just obese. I need to go to an obesity specialist. And so that might be one of the first doctors that they see. The other first doctor they might see is because of the enormous pain in their leg, they think, okay, I must have some kind of vascular issue. I might have a blood clot. So they're going to vascular and vein specialists. And so we're trying to increase the awareness there also, because they may be the first stop for a patient with lipedema.
Okay. So, I think I know the answer to this question, but I want to ask it anyways. So, your practice, you have a private practice, and it seems like people come to you specifically for these conditions. So, this question may even be irrelevant. So, do you find it easy to make dietary recommendations to these patients?
Yeah, that is an excellent question, and I will tell you, I sold my private practice in 2015, but I continued to
Okay.
do treatments until 2020. I happened to stop treatment in January, right before we had all the lockdowns in March. It was related at all. So I haven't been treating since January of 2020, but from 2011 until 2020, I was talking to my patients about diet. And my first book I wrote, Ketogenic Solution for Lymphatic Disorders, was directed to the clinician specifically about how do you talk to your patient about that? Because this way of eating is going to improve their lymphatic disorder. And so how do you talk to them? Obesity is so prevalent and it so I think especially in the medical field, the person who has obesity is suffers a lot of fat bias, anti-fat bias, where they're used to going into their doctor and their doctor is saying, "What is wrong with you? You're not taking care of yourself. You don't have good willpower." And so that, that colors their looks. That same patient will then come in to see me and they just want me to take care of their swelling and I want to talk to them about diet. And there is a little bit of a tension there because they're going, okay, here we go again. There's someone going to tell me that I'm doing it wrong.
Hmm.
And I think that the most important thing that we can as the clinician when we talk to our patients is that I want to share something with you that is totally not your fault because you have been told something that doesn't work and you've been trying probably most of your life to follow that advice, which is not sustainable. And so every once in a while you stop following that advice, but whether you followed it or you haven't followed it, it's not your fault. And that is for the person who has just obesity, like obesity related swelling, not their fault. And then
Mm.
I talked to that woman. I believe that she has lipedema. And I say that now you've got the double whammy because it's really not your fault because you haven't been acknowledged as having this condition
Mhm.
makes your body keep that lower body fat. So first have that discussion that it's not your fault. And then I talk about I have some ideas on things that have been shown to work, and you could try them if you want. I think it will make what I'm doing for you to help, your lymphatic system work better. And as we're going through our course of treatment, it'll work even better if you also adopt this way of eating. And for some patients, it's really easy, and some is, especially I have younger patients, younger female patients that they want to be vegan, they want to be vegetarian or vegan, and I can't get the carbs low enough to decrease the inflammation for the lymphatics
Mm.
if you're going to only have plant foods. I just can't. But I also have patients that are coming to me because they have lymphedema because of their cancer, and their cancer doctor, their oncologist says, I want you on a plant-based low fat diet. I, as an occupational therapist, I cannot make any recommendation that opposes their doctor, you know? So for those patients who would come to me and I know, like I knew in my area who are the plant-based oncologists, I got a referral from that person, I wouldn't even talk diet with them. As an occupational therapist, we are really limited by what the referring physician wants to do.
Okay. So that leads me into my next question. So for other occupational therapists out there that maybe follow this lifestyle and they want to help their patients now, whether this be, they're working for a corporation or not, potentially this might be different in different states, like we discussed earlier.
Uh-huh.
I'm not looking for advice and provide medical advice or anything like that, but do you have any suggestions for that person on how they could
Yes.
approach it with their patients?
Yeah. And so, first, you have to know what the nutrition laws in your state. And I can, I have a good website for that, which I don't remember what it is right now, but I can get that information to you. And so it's a website that has a map of the United States. If we're talking about people that are in the US, it will say what the nutrition laws are in each state because you have to make sure that you are within that. And then the next thing is your scope of practice. And as the scope of practice for OTs, as put out by the American Occupational Therapy Association, eating and meal planning is part of your activities of daily living. And they do say in their documents that that we could talk about healthy eating. They don't say what that healthy eating is, so I feel like I get to choose and I know what the science is saying, what is healthy eating. And so I'm operating within my scope of practice for occupational therapy when I'm talking about meal planning and eating and stuff like that. And so and then now you're within your scope of practice for OT and your state says it's okay for you to talk about nutrition as long as you declare that you are not a dietitian. Now you have to go by what does your facility say? And so, I've found that large employers, especially, so if you work for a outpatient clinic associated with a hospital, and most of the hospitals are large employers, um, that they are less open to doing that. So they may not allow you to discuss nutrition. So in that case, what you can do is tell your patients if you feel like they're open to a discussion about their weight and wanting to manage weight and maybe something is going to be good for their lymphatic system, you offer them websites. This is something that I found that works good for my other patients. Check this out. Be sure to discuss anything with your doctor. And that might be all that you can do. I have had patients that do run with it. I had one patient that came in that he was waiting until he got Medicare before he was going to start treatment with me, but he was about 50 pounds overweight. And I said, you might want to try this certain way of eating that might be beneficial because you'll lose weight and your lipedema will get smaller. And I just gave him Dr. Westman's handout. He took off, came back 6 months later after he had, now he was on Medicare. He can afford to have the treatment. So he came back to see me. He had lost over 50 pounds and the size of his legs was so reduced. I mean, we would do treatments for about a course of treatment would be 3 to 5 weeks. I
Mhm.
would not even have achieved that much of a reduction if I had worked on him daily for 5 weeks. He
Wow.
he went down so much just from that he lost that weight, but I think it was more than that. He lost that weight plus he was feeding his lymphatics. So his lymphatics were working better and he had less adipose tissue. And he was spectacular, but so we did a couple weeks of treatment to get it down a little bit more, but the main thing was that he changed the way he ate. It was I would have him come in as a guest speaker whenever I had groups of people that were thinking about adopting that way of eating. They all have lymphedema, they might have had a weight issue, and I have him come in and talk to them, and he would tell his story and it would just be so astounding that I think it helped to motivate people. Here's someone who's like me, a taxi driver, it's and he did this and pretty much on his own. And so that would help motivate people.
That's awesome. Those are really good tips, and I'm sure somebody will gain benefit from that because something has to be done. Like you said, this is a ground up movement, and we got to do every little bit that we can, and in every situation that we can to make change.
I've had many patients that it takes them a while and sometimes years to decide, okay, I think this is something that I want to try. I mean, you have to let them take their own time. And it could be a couple months or it could be years. And, I was in the practice for quite a few years. And so I was lucky enough to have some people come back and say, okay, now I'm ready, help me. Or guess what? I finally did it. And they would write me letters of gratitude. I didn't do anything. I just gave them Dr. Westman's handout. And they finally, after, a year or more, did it themselves. And this is what they accomplished.
That's awesome. Yeah, I love that. So, my next question has to deal with if you don't know, I am filming a documentary with another gentleman essentially about the carnivore diet called Healing Humanity. And one of the main characters, if you will, in this documentary is Bill Knott. He was over 700 pounds and was losing weight rapidly on the carnivore diet. He started to have like neuropathy type symptoms and just pain and things like that in his legs and back. And he went to quite a few specialists to try to figure out exactly what was going on. And it ended up being his lymphatic system was seemingly clogged with toxins or whatever it was that he was dumping as he was losing so much weight rapidly. And the thing that actually helped him the most that he says is absolutely miraculous for him was a vibration plate. So,
Mm.
have you heard of
Yes.
that? And
So,
have you used
yes,
that?
this is, excellent, excellent information. And it is actually something in the last, I would say, 4 years that I'm actually investigating a lot because I also had someone else with of size like that, and he used carnivore, and he actually gained some weight, and it was all fluid, so we knew it was lymphatic. And so what we're finding is, so everything that drains from your head, neck, limbs, and legs is gonna go through the central lymphatics deep in your trunk. It really lies in the main vessel for that, the thoracic duct, lies next to your spine. And so what's
Mm,
happening with someone who is having those kinds of issues, or maybe already had an innate issue, is that if this is not traveling like it should, and it eventually comes up, and then on the left side, it goes into your blood, it takes all that waste, as you're talking about, going up through the lymphatic system and then goes into your blood, fills through your liver, kidneys, and you urinate the excess out. Well, if it's not going like it should, it refluxes. It goes, and I don't know if this guy had any difficulty with breathing, but it would go back to the lungs. It goes back in the kidneys. They start having kidney function. It goes back to, we have a lot of lymphatics in the intestine because that's how we get the fat from our diet. It mobilizes through the lymphatic system. And so if you're going to go back to the intestines with it, it's going to reflux that way. You're getting GI issues. And so we're having these people are having horrible abdominal cramping and other gastrointestinal illnesses, decreased kidney function and liver function, and difficulty breathing, and it can even affect your heart function. So, and now they've been on a ketogenic diet and they lost a bunch of weight, and then the doctors want to say, "Oh, it's that keto or that's carnivore. That's what caused this problem." No, this person has a poorly functioning lymphatic system that is now more evident since with their improved health and mobility and all the lost weight.
Mhm.
It may be that he, as part of his 700 pounds that he had, was fluid trapped in his trunk because his lymphatics were already not working properly. I believe, and I would love to do a study on this, but those people with a morbid obesity that have an apron, and it's that abdomen that really goes down and sometimes hangs down to the knee. And I've seen people that leak fluid out of there. So my hypothesis is that they have a trunk lymphatic, a central lymphatic issue that is causing their abdomen to fill up. I mean, I've seen people with these aprons that their legs are not that big. The
Mhm.
obesity seems to be all centered in the trunk and in that abdominal apron, that's weighted down with fluid, and, um, they're told that that's just because 'cause you're morbidly obese. I'm wondering if it is actually a lymphatic issue, and the lymphatics is not traveling like it should, it's just backing up, and because of gravity, it's weighting it down, and
Mhm.
the problem is that you then get this organ dysfunction, you know? Um So I'm so stunned they were able to figure out it was a lymphatic issue. And yes, that is an excellent way to handle that is with vibration. It can help mobilize the lymphatics. It's also good
Mhm.
for a lot of other things like bone health and stuff like that. And then we're also investigating. There's a certain massage techniques that help the lymphatic fluid travel the right way and get it to the blood circulation where it should go and not refluxing into the organ. We also do a lot of stuff with deep breathing because breathing causes those lymphatic vessels to contract and pump fluid down. So we'll do that. We're, I mean, it's all experimental right now because we're finding that a lot of people potentially have a dysfunction in those trunk lymphatics that need help. And in that case, we tell them this is not a high fat keto or a high fat carnivore. It has to be only a moderate fat, but you
Mhm.
really got to keep the carbs down. So there's some ways that we want to adjust the diet. We're experimenting with exogenous ketones.
Okay.
Maybe they can get the energy they need from the exogenous ketones rather than a lot of fat. Because all the fat, as I said, it's got to travel through the lymphatics. And so if they're eating a high fat keto, they might just continue like on my one guy who gained weight on carnivore because he was eating a lot of fat with it and his abdomen just got worse because those lymphatics are not working.
That's interesting. So just to clarify too, that it wasn't the clinicians and medical professionals that actually recommended the vibration plate to
Huh?
him.
Uh,
None of them could provide an answer. They were no help whatsoever.
yes.
This was this was actually another lady. She has a YouTube channel called Limitless Lindy. So her name's Lindy Barker, and she was 777 pounds,
Huh?
and she used a vibration plate to relieve the lymphedema. And she
Nice.
suggested to another gentleman, Todd, a friend of mine, that he was over 700 to use the vibration plate. He said it worked wonders for him. And then we finally got the message to Bill. And once he used it, then it was, he says it's miraculous.
It's coming from the grassroots. People are figuring things out, and now we have to give them a platform so that they can, share this with others. Not only nutrition but alternative treatments like the vibration plate. That's fabulous, and I'm glad that that worked. We are um, doing a lot of experiments with self experiments with vibration that seems to really help with this. I had one person that she was using singing bowls that put them on her belly, and then you hit the bowl and it vibrates. I
Oh,
mean, another way
interesting.
of getting vibration, right?
Right?
Um, think outside the box. These are non-invasive things. Eating, not so invasive, although when you eat sugar, it's pretty invasive. But but think about, there are a lot that you can try um, cautiously that might help.
Absolutely. So I did reach out to those 3 individuals before we talked here and kind of discussed, what are some questions that they could ask you. And one of those is there anything that can be done to manage or reduce lipedema?
Yeah, and so, what we are finding with the initial success with keto was exceptional. And I think that there's always some variation in conditions, and lipedema is no different. And some of the women, once we found out about carnivore, because I didn't know about that in the beginning, I was happy to ditch plants. But once we found out about that, they started experimenting with it, and some really did not like it at all, but others, it was like it gave them another kickstart to go carnivore. So some women with lipedema need to be at that lowest state of carbohydrate intake that we can. And it takes a little bit of experimentation to see if you should be high protein or high fat carnivore to see what works. But yes, definitely, I would say the diet is the number one thing to start with for lipedema because one of the things that we noticed in our Facebook groups of over 14,000 women doing this is that
Wow.
the pain goes away before any weight is lost. And what they've been told their whole life is if you just lost weight, your pain would go away. And you know what? There are women with lipedema that have like a lot of pain and they don't have their lipedema is not that severe. So it is not to do with weight loss or fat loss. It is, well, it's to do with the uh, lipedema fat loss, the inflammation in that fat. And so I had one woman who said it was 6 days, 6 days of a ketogenic diet. Her pain, which had been 8 to 10 out of 10, was zero in 6 days. She didn't lose any
Wow.
weight in that amount of time. So, so I would say start with diet. Once you have diet dialed in, there's lots of home things that people do. The vibration plate. There's something called dry brushing where you can just, brushing on your skin, and exercising in the water because the water is compressive, but it's supportive also. Wearing compression garment. There's lots of things that you can do. I would also suggest that you go see a certified lymphedema therapist that has experience in lipedema because there is specialized massage technique that they do. Um, uh, and they will guide you in getting the proper compression that's going to be comfortable and effective. So, your lymphedema therapist will be your best friend because they'll open your eyes up to all the resources that are available.
I love that. So another question here. My good friend Carrie, that I'm doing a documentary with, his wife Jen, ever since she birthed their triplets,
Uh-huh.
has had a water retention in her legs.
Yes.
And he had mentioned that it's always been a little harder. And she
Yes.
started the carnivore diet, and I think she's day 12 or 13, something like that now. And now it's starting to not feel as hard anymore. So would that be considered lymphedema?
So, and it could be lymphedema or lipedema. I will tell you the most common onset of the lipedema symptoms are at puberty, pregnancy, and perimenopause. So they think it is somehow influenced by perhaps by female hormones. Those 3 times in a woman's life also happen to be at times of natural insulin resistance. So it could be insulin hormone and not a sex hormone, or it could be a combination of the 2. But,
Mhm.
I would say that, um and also primary or hereditary lipedema, sometimes that's when it shows up too, is at those times in a woman's life. So she could be lymphedema or lipedema. That it happened around her pregnancy, to me, highly I suspect that it is some kind of lymphatic condition and that it responded to a carnivore diet, kind of solidifies that. I wouldn't know which it is unless I actually, talk with her and palpated um, and examined her. But it's highly likely that she has a. How far out is she from the pregnancy?
Oh, wow. I think the triplets are almost 17 now.
Okay. And also when you think about triplets, that is it's quite a bit of trauma in the abdomen of a woman, in the abdominal cavity. And we have a lot of lymphatics in there. And so, it could be just the trauma of that pregnancy with 3, um, babies in there that, could have caused trauma to her lymphatics. That it's not like it's irreversible. I mean, but it would have been better if she carnivore prior to the pregnancy and ever since.
Mhm.
May not have progressed to where it is now, but thank goodness she's trying it now because I do think that she can rescue a lot of that lymphatic functioning and hopefully reverse what's happened.
Ah, that's awesome. I love that. It's always good to hear hope is
Yes. Yes.
yeah,
So
absolutely.
she might wanna investigate getting, some, lighter weight, not super aggressive, but lighter weight, support stockings, and something, that goes up, uh, to her waist,
Mhm.
so like a pantyhose type style, um, that, she wouldn't have to wear all the time, but she may find that it gives her some relief to have that support on there. It supports the lymphatics to get the fluid to go up.
Right? Yeah, that's awesome. So, I had one more question here. If somebody has a mass of fat that is stubborn and won't seem to go away, can it just be removed with the excess skin once they've lost weight?
Uh-huh. Yeah, so this is not unusual with, well, lipedema and lymphedema in both conditions can get that because what happens when you have stagnant fluid, it actually attracts or it causes adipogenesis. So the longer you have stagnant fluid, you get that buildup of fat in there that then becomes hypoxic and leaky lymphatic vessels, and it's a snowball effect. So you can have people have had these lobes of area that can have that dysfunction happening just there, and even though they've lost some weight, they still have it looks still a little bit lobular, and, because the tissue is so dysfunctional at that point, it's even after you've lost some weight and maybe a little bit of fat inside that lobe, it's still not functioning properly, and so, it can be difficult to get rid of that last little bit, and so, yeah, they do sometimes do lipectomies, to, remove that along with any excess skin. Um, that can be done. It, they've already put themselves in a healthier place to go through a surgery like that if they have, lost a lot of their fat and water weight by doing keto or carnivore. They're going to be safer and do better in that surgery because you can imagine if you still have a lot of fluid there and a lot of diseased or pathological fat there, you're not gonna heal well from the surgery, and that you would have to have probably a pretty large incision to remove that and the excess skin, and then that incision is not gonna heal well. But if you are good with your diet prior to and after, you're gonna have a much lower risk of getting an infection or poor wound healing. You would have a much better outcome.
Yeah, that's awesome. I wish my mother would have known that prior to having her loose skin removed because she had infections for, I think, 18 months. And they convinced her to do the front and the back at the same time. And that was probably the worst thing that she could have done.
Yeah, and so you gotta think that if you have those lobules that are, pathological tissue there, and so your both your blood and your lymphatics are not circulating as they should. They're not removing pathogens and waste products like they should. Your lymphatic system is your immune system. And so if it's not functioning like it should, you are ripe for an infection. And so that definitely would have helped your mother to be eating this way.
Absolutely. So I got one more question here
Mhm.
before
Hey,
we,
I could talk all day.
yeah, I could too. So, um, if someone loses a lot of weight and needs to have that skin reduction surgery, how does cutting that much tissue off affect the lymphatic system? And, does it just heal up as the skin heals or?
So I would highly recommend that if you are someone that had a lot of swelling, a lot of edema, a lot of water attached in there, along with your excessive adipose tissue, and so sometimes you have that loose skin, and there's still some fluid in there if you're still eating a standard Western diet, that you want to go to actually a plastic surgeon that knows about lymphatic disorders, because they will do the procedure in a way that is what they call lymph sparing. They're going to be very careful of the lymphatics when they do the procedure, versus a plastic surgeon who's not knowledgeable about this. I mean, the lymphatics are invisible to the naked eye. It's a clear fluid that goes through them. So they're completely disregarded. You can see the blood vessels, the veins and the arteries. And so they're being careful not to nick that. But they are destroying a lot of the lymph. And you can end up with lymphedema after a surgery because there was no care for the lymph. In the trunk, it's a little bit different because especially if you after you eat any fat, the lymphatics are white, and so because it's transporting that fat. So, but before a surgery, you're typically not eating anything at all, right? And so
Mhm.
even those lymphatics can be clear, and a inexperienced surgeon doing a tummy tuck or something like that could, destroy a lot of lymphatics. That's why some people get a lot of swelling in their belly after a tummy tuck. If it was by a surgeon that didn't take care.
Wow. So, would the suggestion be the same for somebody that is actually on a carnivore diet? Like, for instance, my friend Lindy, she's lost over 500 pounds from 777. And then now she obviously has a lot of excess skin, but she's
Yes.
still strict carnivore, almost lion diet right now.
Yes. Yeah. So yes, she's going to be. I would say that yes, this is someone that probably has a lot of stress on their lymphatics from when she was so large, and so I would want to go to a plastic surgeon that is familiar with that. She can go to our website, lipedema-simplified.org, and there is a provider directory on there. And you can choose, do I want a therapist or do I want a surgeon or a doctor? And you click, what specialist you're looking for, and it will say where they are. Now, there's not a lot of them. And so if you're going to pursue that, you might have to travel. Because what this person, this experienced, knowledgeable plastic surgeon is going to do, not only they're going to take care with the procedure, but they're going to tell you what to do after the surgery. They're going to have you in the supportive compression garment. They're going to give you guidelines for your movement and exercise. I mean, they're do everything they can to set you up, except for nutrition. I only know one that talks about keto, and he's up in Delaware, I think, um, and Dr. Shapiro. But most of them are not going to say anything about diet, but they will have a lot of great recommendations of this is how what you need to follow these rules after you've had your procedure. And that's going to be the best person for her to see and probably the safest person for her to see.
Awesome. I love that. So you're you have a coaching course right now, is that right?
So I have a program called Lymphatic Lifestyle Solutions. It
Okay.
is it's a self-paced program of 7 modules. The first of which is information and how to do a ketogenic diet. But then if you buy the community package, we have lots of meetups throughout the months. We have Ask Me Anything. We have a meetup with different vendors, for instance, that do vibration plates or do compression garments. So we talk to our community. Um, we do just a self care meetup once a month. So we're talking about how do you do your self massage? What are good breathing exercises? How should I do skincare? There is lots of live stuff, but the base of the program, the education, the learning really happens in those 7 modules.
Okay. Awesome. Now is the pricing on that public, or is that something that's you don't
Oh
really put
yeah,
out there?
so I'm terrible with pricing, but I do believe you can do $49 a month to get access to everything. And there's also some packages for if you don't want any of the community stuff, you just want, you can get a year of just the self-paced learning. You could buy that. And I honestly don't remember what that is. And you can also buy a year of the full community package. But some people like to do the monthly thing to make sure that, okay, this sounds like the good community for me. I'm going to start with that. And then I might, buy the full year or something. So, and that is, I think I gave you the link for that for Lymphatic
Mhm.
Lifestyle Solutions. It's with my partner, Robert Erkstrom. He has a private practice in lymphedema therapy in North Carolina. He's not that far from Dr. Eric Westman, and he actually shadowed him in his clinic to learn more about using a ketogenic diet for his patients. And he and I collaborated to put this program together. It was actually the lifestyle program that I did my research on, that I had 10 of my patients go through this lifestyle program and to see, and it promoted a ketogenic diet and how did they do. And I was so naive when I did the study because I thought, well, I'm just going to tell them the science, and of course they're going to do it because the science shows that it works. and so and so I was a little bit shocked that I had 10 participants and 6 used the diet and 4 did not. And the 4 that did not were so apologetic. "I'm sorry. I hope I didn't ruin your study." I said, "Well, actually, kind of. It was a nice comparison because it was such a startling difference between who used the ketogenic diet and who didn't." The ones who
Wow.
used it had so many all these good I had 10 different outcomes that I was looking at that I was documenting, and they all did good over here, and the ones, that didn't really do anything. And when I, did the average of everybody altogether, it still looked like the program worked because the ones that used the diet did so good that they kinda dragged everybody else with them.
Mm.
So that, when I put together that program for the research study was pretty much it was, further developed with, Robert to develop this online program.
That's awesome, and that's a very reasonable price, $50 a month. I mean, that's nothing in terms of, what your health worth to you. So,
Uh-huh.
yeah,
Exactly,
definitely.
exactly. Yeah.
And this is something that's very specialized and very much needed. I think more needed than most people even realize.
Mhm,
This is not a subject that's talked about very much.
mhm.
But I think that it affects more people than what we realize for sure, especially in this space. We talk to people all the time. I've got this mystery thing going on and I don't
Yes,
understand what it is.
yes.
Very well could be that their lymphatic system is not operating like it should. And,
And
you know, it could be a simple solution.
mhm, yep. And I think that the base of the solution is diet. They're probably gonna need other things as well, but if you don't have the diet, the other things are not gonna work. So we have to have the diet.
Absolutely. So, can you run through your different avenues that people can reach you?
Sure. So you can email me at leslynkeithot@gmail.com. Both my partner Robert and I use the same Gmail. We use lifestyle@gmail.com. You can reach me there. Um, you can go to my website also to learn more, leslynkeith.com, to get more information there. I think those are the main things. And of course, if you have lipedema, please go to the lipedema websites. And if you're on Facebook, you go there. So lipedema-simplified.com or lipedemaproject.org are the two lipedema websites. I do a little bit with lipedema on my websites, but really, I do a lot of volunteer work with the Lipedema Project and Lipedema Simplified, and so I'm heavily involved in those organizations as well. And as I say, when Catherine and I first started collaborating, we were all about the keto. Now we have branched out to talk about emotional health and social and all the other aspects of a person. But
Mhm.
at the beginning, we were so excited. We were all about the keto.
I love that. So do you have any last words before we wrap this up?
I would just say, I would ask people to consider their lymphatic system. It's something that is um, pretty much ignored. You don't know that you even have a lymphatic system until something goes wrong with it. And if you're already doing keto and or carnivore, you're already helping your lymphatic system. So consider your lymphatic health because that's going to have a huge impact on your overall health.
I love that. Well, Leslyn, first of all, I want to say thank you to my lovely wife and my OT wife for recommending that I contact you. And this connection, I think, is going to be key in this community because I haven't seen this really talked about a lot. And, making this connection, and hopefully we can get you more incorporated into the space and get you connected with more people to provide a means for relief and help for folks that need it that maybe not even know that they need it at this point.
Right.
So
Yeah.
thank you so much for joining me. It's been a pleasure. I'll make sure I link all of your links and email addresses and things like that in the description below. So
Mhm.
thanks so much for being here.
Thank you so much. This is wonderful talking with you, Adam.